Welcome to Hotness, the podcast that brings you practical tools to balance your hormones and rekindle connection, confidence, and desire in midlife and beyond. I'm your host, Dr. Liz Lyster. Hotness is a safe space for honest conversations about menopause, sex, identity, love, loss, reinvention, and desire, because you can embrace your hotness at every age. Welcome to Hotness, the podcast that brings your hormones, confidence, and desire back online. I am so happy today to share with you my conversation with Stephania Humphrey, osteopath based in the San Francisco Bay Area. She is a gifted healer. She's a British-trained medical osteopath. She treats complex presentations of various conditions, autonomic, immunological, nervous system disorders. Her method is a gentle, hands-on approach of palpation and treatment. I have had personal experience of being healed by her wonderful hands. She cleared up hip pain that I went to orthopedists, pain management, chiropractic, physical therapy. None of them made a lasting impact. And finally, I worked with Stephania and got incredible relief. It was really a mental relief. We talked a lot about the connection between stress and hormones and the nervous system. And I am very delighted to share with you my dear friend and colleague, Stephania Humphrey. Enjoy. Hi, Stephania. Welcome to Hotness.
Hi, good morning.
I'm so delighted to have you here for this super fun conversation. I want to start off by sharing with our listeners that you helped me after I spent probably about 2 years. I had a really bad hip pain during the pandemic. I went to orthopedic surgeons. I went to pain doctors. I had the x-rays. I had the MRIs. I went to PT, and it really made no significant dent. And I finally made my way to you. I finally went outside my medical insurance and went to you, and you quickly, within a few weeks, got me feeling dramatically better. Can you talk a little bit about what it is that you do that's different than other type of body work? You can describe the osteopathic work that you do. And if you remember what you specifically did for me, I know it was a few years ago now, but it's been a lasting, huge healing for me. So tell us a
Well,
little bit.
I'm so glad to hear that you're still feeling so much better it was a couple of sessions I think that we did. To answer your question, I am privileged and so honored to be an osteopath. I think our profession is really beautiful. You know, just a quick background, we spend years feeling and palpating, meaning we learn medicine, we learn pathology, we learn to diagnose, but we use our hands for all of those things. And so if you can imagine, if you spend, even just 5, 6, 7 years, and at this point I'm 16 years in, using your hands to feel how the body is moving or where it's restricted, you can develop this kind of, superpower, I would say, because that's all you do. And I think that goes the same for any specialist in any field, right? So my specialty is that it's the hands-on manual osteopathic medicine, and it's my way of being able to feel, understand what might be happening in the person's body. So for you with the hip pain, there's a few different structural elements that played a role in that. And I think you mentioned to me once before, it's very subtle and gentle. So as I'm looking at the body, I'm looking at subtleties in the way that you move, in the way that you stand, in the way that gravity is dispersed through your body, whether you're standing or laying down, and then taking all of that information and using my hands to gently move your body in a way that it releases it is how we get those subtle changes very effective long term.
Absolutely. Different than chiropractic. Chiropractic is frequently more of the forced types of adjustments, which can have their role, but what you do is totally different from that. It's not forced at all, I believe. Is that correct?
That's one of the principles I would say that I work by and that my profession also strives for, which is we don't need a lot of force to get things to move in the position that we want them to, or we're more aligning with what the body wants and what the intelligence of the body is dictating. And I agree there's a lot of room for adjustments or more forceful things that we need to do to the body. There are times when a rib is out or we have a dislocation, so we are definitely in need of that. So it's a combination of those things.
You talk about the root cause of pain, and I know that you talk about stress as it goes into the body. This is something that you and I definitely have in common. I've been sort of an avid reader of this. Louise Hay, her books on the metaphysical causes of dis-ease and illness. So how do you incorporate that into your work? If you can think of an example, someone who you know that stress is just playing an incredibly huge role in how she's feeling, how do you approach that? What do you do differently?
Yeah, I mean, you are asking a really beautiful question here because this, I think, is the reason why most patients come to see me. They are a combination of stressed out, maybe an accumulation of stress has hit a point in their life where they're broken down, whether it's more physical or mental, a combination thereof. So treatment wise, one is acknowledgement. I think sometimes patients, all of us, we go through our life not really understanding how much we're taking or holding. And when you walk into the room with a practitioner like myself, you suddenly have space to reflect and go, oh my gosh, I haven't processed a loss that I went through. I haven't had time to spend enough quality time with my kids in the last 6 months because I've been so distracted or busy, or I have an injury and I'm working through it and pushing through it. And so all of that creates stress in the body and in our nervous system. So one is just acknowledging what a person has been through. I think empathy plays a huge role in just being able to unravel and then acknowledge our strength too. And our courage to come in to look for change or try something we haven't tried before. To your point earlier, you tried everything that was recommended to you. You were like, yep, now I'm going to try something that's foreign to me, right? And take a risk there.
Common in both of our practices. People do as much as they can inside their insurance world, and finally they just need to get the actual help they need and then actually get better.
Exactly. And I do think that in time, insurance can catch up to some of the modalities that we're doing, but we might be on the more of the forefront edge of things changing or receiving patients in a way that they want to be received. And the insurance system is just a little outdated still, but it's catching up, at least trying to.
Hopefully.
Yeah. So, I think back to the nervous system, I think one of the kind of terms I like to use is tired and wired.
Mm-hmm. Yes.
She can come in just frazzled, exhausted at the end of their hope, maybe for something that will help them with their pain or discomfort. And so treatment wise, as we said before, it's very subtle, it's very gentle, and just acknowledging the nervous system being in a state of fight or flight. It's not had an opportunity yet to completely let go. And again, there's some vulnerability there too, right? But
Absolutely.
It's being brave. It's being brave, allowing yourself to feel vulnerable in a safe container with a practitioner you trust, whether it's me or a different osteopath or with you, Dr. Liz, and allowing for that starting point of healing to occur.
Yes, because it's embedded in the body. I talk about that with my patients a lot, which is my practice is primarily really busy midlife women. And so we handle things. We can handle it. We cope. We have all these coping strategies and mechanisms, but the body still absorbs it. The body still takes the stress on.
Yeah.
Right. And so that's probably what I end up referring people to you. Is because we're doing a lot of good work and that she's feeling better, but we know that something's still, the word that's coming to my mind is lodged in the body. Does that resonate for you? Because I feel
Totally.
like it's lodged and you're sort of dislodging.
Totally. There, and it's synergistic, right? There's a symbiotic relationship between you and I, and some other practitioners too play a massive role in helping a person heal and recover from something, specifically around the nervous system. So when we are kind of run down and depleted, I can sometimes feel it in the body physiologically. So there's a vitality to the body when someone's very healthy. And there is sometimes either like again the kind of frazzled energy that a person can hold when they're running on empty, or they're just performative, high producing type A types. They have a different type of energy in their body, and another type might be more subdued, heavy, perhaps in a state of grief or depression. And neither of those match the sort of healthy vitality that we want. And in either of those extremes, because they can become very extreme, the physiology needs some support. And so that's where I, often will work with you and have people, and, there's patients with all kinds of conditions, laxity issues, compression, tension issues, arthritic pains, and they all need a slightly different combination of care and support physiologically, which could be hormonal, to help them find that inner balance again.
My angle on all of it is the hormonal environment to optimize the cell function and muscle function, right? So that, of course, the work you and I do is definitely very symbiotic. People might hear your lovely accent. I adore your accent from Europe. Do you feel you can say whatever you would like about being from there? But I'd like to ask you about how that influenced your training and what differences you see between your training and what people maybe expect in the US. A little bit more about you for us.
Yeah. So I was born and raised in Belgium, and my father was from the US and he ended up in London. And so I grew up in London. So my accent is this kind of blend from different parts of the world. I feel American, Belgian, and a little bit of British kind of all sprinkled together. I would say the education in the UK is really good. It's high quality. And I am very grateful for having studied osteopathic medicine over there. Fundamentally, we're very traditional in training medicine through the hands-on approach, which is the original kind of idea behind osteopathic medicine. In the US today, the DO degree is not dissimilar, but it's definitely become very, very medical. I think, to be honest, it always was, but there was a heavy emphasis on the hands-on medicine, which is seemingly becoming a little bit less than it was before. And so a lot of DOs now graduate college in the US and will specialize as surgeons, oftentimes go
Yeah.
into regenerative medicine. Maybe
Same as MD.
yeah, you'll have
Yeah.
a primary care DO who may or may not do any kind of hands-on osteopathic work. And so the distinction to be made is if anybody were to see a manual osteopath who's European trained like myself, we wouldn't be doing any kind of primary care or any prescriptions for the patient. We would focus exclusively on our skill set to manually treat the body and then guide them,
Beautiful.
with what we're listening or what we're finding in the person.
Yeah. Yeah, I love that. That's amazing. Let's say a little bit more. We've been mentioned our clientele that we have in common. Of course, my main clientele are women in midlife, and
Mhm.
there are some men as well. And I know you have a wide variety. You basically take care of all ages,
Mhm.
I believe, right?
Yeah. Yep.
Yeah.
I would say so. I have another osteopath in my practice who likes to work with women's health and children, kind of a slightly more pediatric focus. And another osteopath who works
Nice.
with us likes to work with surgical care, pre-post surgery. I'm sure, Liz, you see as well a lot of women who've gone through, you know, breast cancer, mastectomies or hysterectomies, all kinds of gynecological issues there. And I see a wide mix, mostly I would say 30s to 60s. I tend to be, I would say, I love working with transitions. I love working with the transition of the different stages of being a man, the different stages of being a woman. Menopause has a big, big, you know, attraction right now because women do experience these cliff changes that happen in their bodies and their minds. And
Yeah.
so I love to work with old people kind of going through those big life changes.
Yeah, that is great. I would like to talk a little bit more about that. So, women in midlife, hormonal changes, stress stored in the body, chronic tension, big life changes, job changes, family, household changes, just all sorts of things going on. How do you specifically work with women going through all of that to help release what they're holding in their bodies to help release that? Say a little bit more about what you do in that particular environment.
Yeah, the first thing that comes to mind when you ask me that question is with any change, we're contracted. We don't want to let go. I think this is a huge lesson in life for all human beings is embracing, accepting, and letting go. And it is so scary. A small child who
And
has to
painful. It can be
pain,
painful. Yeah.
very a small child who has to learn to stand or walk when it was comfortable, she was comfortable just laying, being tended
Yeah.
to. That's analogous for all the changes that we go through as adults too. So specifically with menopause, I see women who we're influenced by what we think beauty is and what we believe attraction is and where our worth is. And often our worth is in our fertility years or fertile years. And
At least
the
according to society. Hmm. Sure.
correct, right,
Yeah.
yeah. And I think we're all
And then we integrate that in our own minds. Hmm.
exactly right. Exactly right. And you and I can intellectualize that and say it's not true and we can be different. But still, I think we're all living with a degree of perception of what we think success, beauty, or thriving means, right? And there's a perception that with menopause, we just go downhill. So what I see a lot of is women coming into my practice confused, frightened, contracting, holding on to an idea of what their body once was exactly like really
Yeah.
tight.
Just picturing it. Hmm. Yeah.
Exactly. And you can
Yeah.
imagine when we're gripping tight and our muscles are tight and we're frowning in our face, we don't feel good. We develop nerve pain. We have multiple joint issues. I was speaking with someone not so long ago who said she's scared to move now because she's aching more since she started her menopause years. And so she's like, now I'm worried my life is going to start shrinking because I'm
Mm,
feeling less capable and less
mm.
confident, actually.
Oh,
So,
I'm getting emotional because that's the whole point of my world. And
no,
this podcast is for women to know that that's not our necessarily our
our
destiny,
path. I
that
agree.
we can
I
change the
agree.
path. Mhm.
I agree. And I do want more women to hear this message, to know
Me too.
that one,
Same.
one is we're living longer. We have access to more healthy things than ever before. So we can take advantage of more things like that, whether it's diet or the way we care for ourselves, the way we speak to ourselves, and taking advantage of things like supplements, hormone therapy. These are all the things in your realm of support that we can rely on and make us feel really good. And then there's the sort of perhaps more spiritual shift that happens where we let go of our childbearing years, of our youthfulness to some extent. I was also reading recently that we tend to be a little more go-getters in our younger years, in our 20s, 30s, 40s even. We're holding families together or we're working full time or we're doing both of those things. And then
Yeah.
come menopause, our kids are older, or if we don't have kids, we have different responsibilities. This is a time in a woman's life I really believe we can shine. We
Right? I totally
speak
agree.
to our
Yeah.
kids. And so how do we now reframe menopause into a completely different phase of our life where we are perhaps even more giving, more sharing, more confident, than we were even before.
I love that so much. That is just beautiful. I'm really taken by something you said earlier about the vitality that you can feel in the body, that you can feel it, right? You're saying that you can feel it in someone else's body. That's how I
Yeah.
understood it and from having worked
Yeah.
with you. So I just want to clarify. Okay.
Yeah.
I mean, that's just so incredible. And that's what I am here for. I'm here for people to be able to reconnect with themselves and reconnect with that experience. So that's absolutely amazing. Anything else that you want to say about the work that you do? What's different and unique? Your practice is very unique. You have different practitioners as part another osteopath, but you also have other angles that are part of your practice.
Yeah,
Yeah,
correct. Yeah, I'll speak a little bit more to kind of individual and personalized care, because in the realm of feeling vitality, it is different for every single person. Some patients have very high energy and they perform well at that level, and some patients are just more chill. Some people are more like, I don't have a lot of ambition and I don't want to necessarily do certain things. And so vitality is also on a continuum of, everyone is different. And that also
I
goes to
like
say
that.
with, I have some women who come in and you can feel if their estrogen or progesterone is too high or too low, they don't feel well. And there's a quality in the tissues that you can pick up on that is not aligning with their best self. Whereas there are some women who do really well, maybe with higher estrogen levels. And you can speak to that, Dr. Liz, more, right? Is like, oh,
Right.
maybe testosterone works for some people really well in higher levels. And yet in some women, they're like, no, that's too much for me. So it's really being able to fine tune what is feeling your best and what is vitality for the individual.
I
So there's
love that. That's like my whole reason for being. I'm so excited. I already knew that I loved you, so but that was already established.
And then just
How
quickly with regards to my practice, just to answer that question, I really value the mind as well as the body. I think those of us who suffer with deep opinions or right and wrong or judgments about life often suffer quite a bit, and it can manifest as physical pain or a closed posture or isolation withdrawal. And so I really value working with psychiatrists, psychologists, different forms of somatic body workers, therapists. I did a lot of training in that field and in that realm, combining kind of mind, body, emotional pain. And so, there's various people and specialists, as well as orthopedists, physiatrists, primary care providers who I collaborate with. And my whole team here collaborates with a nice village, including you, for our
right,
patients.
exactly. It's a gorgeous village. Who else is on your team?
So I right now have a strength and mobility coach, and I'm hiring for more of those. So we really focus on, once the body feels aligned and you're healthy, get strong, lift weights, learn how to move well so that you don't have any injuries anymore moving forward. And it's now just the team of osteopaths that we're focusing the practice exclusively on osteopathy. And then we have
Right.
our referrals very close by. So in the same location, within just a few mile radius, we have a team of psychologists and some body workers and some somatic coaches too.
Beautiful. That's absolutely amazing. And it's an integrative model that I hopefully will become it's becoming more popular, but it really needs to get covered by people's insurance. But for now, we're going to focus on helping the people that we help because we know that we do it more quickly than the regular medical world that's out there. If someone wants to reach you to work with you, what is the best way to connect with you?
Yeah, the best way would be through email. So the practice email is contact@b-wellcollective.com. And our phone number as well, you can call or text us. So 650-241-5033.
Wonderful. Yeah, that's in the San Francisco Bay Area. And I will make sure that that's in the show notes so that people have those. I want
Great.
to wrap up with a question that I always ask each of my guests, which is personal. What is one way that you personally connect to your own hotness, your own
Ah,
vitality?
that's a great question. There is, so I have a very spiritual practice. And so through meditation and through being by myself, I get to change my posture in the abundant being that I believe we all have access to. And you can tell I'm smiling as I'm doing it.
Yeah, absolutely. Like
Meditation.
radiant. You're radiant.
Yes.
Yes.
Changing my posture, meditation, and just making this internal shift from being critical to being self-loving. So it's a daily practice, but that's how I connect with my internal hotness.
I love that so much. That is absolutely beautiful. You are beautiful inside and out. Thank you so much. I've, of course, knew I was going to enjoy our conversation, and I will look forward to getting to see you again soon.
Yes, me too.
Thanks for listening to Hotness. Help more women find these practical tools by liking, sharing, and following the show, as well as leaving a review. As a gift for listening, go to drlizmd.com/hotness for your free midlife guide filled with powerful support for your mind, body, and soul, because you can embrace your hotness at every age.